Over 180,000 Americans have died from COVID-19. This is the phrase countless health officials and politicians have stated over and over again to drill into the heads of the American public that coronavirus is actively killing everyone, no matter your health background, and it will kill you too. But there must have been a misstep in CDC reporting on coronavirus death numbers, because new CDC reports are showing that the number of deaths where COVID-19 was the sole cause of death is closer to around 10,000. The CDC has updated information in regards to how they count coronavirus deaths to read that only 6% of the 180,000 deaths are solely due to coronavirus. Other deaths added to the COVID-19 death count have 2 or more serious conditions or causes tied to that death, with the overwhelming majority of the deceased in a much older age range. And while these numbers could easily stem a lot of the coronavirus fears and anxieties we've seen, the media has still, of course, remained silent on it. Let's also not forget a couple months back when we saw the CDC send out directives for states to include probable, aka unconfirmed cases of COVID-19 infections and deaths to their official counts. Remember this council meeting in Collin County, Texas, where 1 confirmed case plus 16 probable cases of COVID-19 turned into 17 confirmed cases added to the total count?
State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases.
So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. So at the end of this definition, there are 15 different options on how you could be classified as a probable case. Based on this diagram and what they report, there's a total of 17 cases now. 1 is still only confirmed because that was that original index case who then had all these contacts underneath in orange. And all the rest of them became probable, but they are still considered a case.
These various news stories of Texas officials having to adjust total coronavirus deaths to lower than what was previously reported then followed suit. Also, despite a huge drop in overall deaths, which we can clearly see again on the CDC website, and before you say that's because we've been in a lockdown, let's not forget that there has been large gatherings of protests and rioting throughout the nation since May. Big cities like Los Angeles, Chicago, and New York are still severely locked down, and families have been unable to open their businesses, go to church, or send their kids back to school. And if your kids are back in school, this is an example of what their lives may look like. In New York, Governor Andrew Cuomo deployed a SWAT team of 71 contact tracers and 8 case investigators upon a New York State university in Oneonta after 105 students tested positive for COVID-19. After hearing of the new cases, the university decided to suspend all in-person activity, and students will not be allowed to leave campus for the next 2 weeks. Facilities such as the library will be closed, and dining services will deliver meals to the residential halls. They will be allowed to go outside, but they won't be allowed to gather in groups, and bus service to and from campus will be suspended, as students are forced to conduct all of their classes online from now on. This type of environment sounds eerily reminiscent of another place where you're confined to a room, you have no option to leave and are told when and who you can go outside with and when you can eat. I just can't put my finger on the place. So while COVID-19 deaths continue to drop, the actual number of deaths where COVID-19 is the sole cause is closer to 10,000 instead of 180,000. Our media, health officials, and politicians still refuse to let us get back to life as usual, and New York seems to be leading the way in most restrictive states. That is, unless you're a celebrity. Then you're allowed to bypass the rules and regulations that are allegedly separating everyone from life and death. If you're an average Joe who just wants to go visit family in New York or continue working towards your college degree, absolutely unacceptable. But if you're a celebrity that absolutely has to fly in for the VMAs, it's totally fine to bypass the rules. Also, if you're a small group of Americans celebrating Trump's presidential nomination from the RNC, you're putting lives at risk. But if you're protesting in the name of Black Lives Matter and want a 55,000 person march on DC that same weekend, that's totally fine and the media will back you. Why is it that only some people get special treatment? Is it possibly because the COVID death count isn't as sinister as it seems? New CDC numbers seem to say so. This has been Savannah Hernandez for Action 7 News.